you
Hi,
doing?
Doc. How are you?
Good to see you.
Good to see you too.
How's it going?
It's good. I'm finally standing up straight.
That
Yay,
took a while,
that was
didn't
fun. And then I'm finally getting to sit on my bum, which that was, seemed like forever.
it? Yeah, has that been really tough?
Just sitting on my bum?
Yeah.
I just started sitting on my bum, and I sit on a pillow too. I don't like to sit on anything too hard. Just because I wanted to make sure that you said it was fine. You said 6 weeks, and so I wanted to just do what I was told.
Yeah, was that hard though for you?
I'd say by week 4 it gets a little weird. You're like, gosh, I just want to sit on my butt.
Yeah.
So I did have my massage chair, so that made it helpful.
Yeah.
You know, because laying on your sides gets old really fast.
How's your pain, discomfort? I mean, how's all that
After I
going?
seen you for my last post-op where I had one more prescription of pain meds, I only needed them for like a few more days, and then I just, you know what I mean?
Good, actually.
Well, it seemed like after a certain point, like a 24-hour period, like when I'd wake up, it was extremely, I felt so much better. It was weird because sometimes mornings were hard, where it was like I just got hit by a truck overnight, but then it came to the point to where you get 24 hours makes a difference in your recovery to where you know, weeks go by and it seems like it takes you a while to get well, but then after like this 3rd week, a 24-hour period feels like a week.
Yeah, you know, it's really tough on patients doing a tummy tuck and the Brazilian butt lift at the same time.
Totally.
It's a fairly, you know, significant, uncomfortable, awkward.
You become like MacGyver, I'll tell you that, because you're trying to figure out what can I do to work it out to where I can drive at week 3 and do things, because you can't not drive for 6 weeks.
So what are you, 6 weeks now, so what are you what's your routines now? Are you back to?
I just started going back to work last week, and I'm a massage therapist, so you know, that says a lot. That means everything's, because I use my whole body when I do massage, so it felt really good. I worked all week. You know? Good.
Now I know it was hard on you gaining that weight.
It's fun for like a couple of days. Because you're like, wow, I haven't had a Frosty in like 10 years.
And it's not going off as fast as you hoped.
You got a tissue? Because I could use one.
No.
I don't like that.
Yeah, I think that once you get back into your routine with your work,
right,
that's your means of exercise.
Well, that's another thing. Like, I was in bed, literally. You know, I wasn't doing anything for 3 weeks for me personally because my skin was so tight, so I wasn't standing. My girlfriend got a tummy tuck, and she was up by, I was like a week ahead of her in the sense that she was up at 2 weeks. I was like 3 weeks in, and I was still bent over. You know, so like I was saying before, you just have to have patience. Everybody's different, because I watched all those a lot of post-ops online, because you said for me to prepare myself and educate myself as much as I could before, and I did that. And you get into this mindset of, oh, well, she's standing up straight at 2 weeks. Wow, she looks great at 2 weeks.
Oh, God,
and then it's your turn, and you're not doing what everyone else is doing, and you're like, wait, what did I do?
You were, your skin was tight. Your skin was really tight, and you know, getting it closed, you know, we really had to be aggressive, so that means you're actually bent over longer, but at the end of the day it ends up looking nicer, because as you stretch out more and more and more, it gets leaner and leaner and leaner. And so I think once you get through that, then get back into your routine and your work for a few months and burning calories and getting back to your good diet, you'll get back to normal. Yeah. So you just have to be patient, I think.
I know, that's the word. That's really totally hard. The word. Yeah. It's patient.
Why don't you stand up and can you take off that for me, if you would, dear? Now, how's the swelling coming down around your waist and stuff?
That's good.
That's what was you were really curious about. You felt like you were so fat for a long time.
It was crazy, because you got to understand, I was really thin before the surgery, because and then I had to gain all that weight, and then I had for some reason in my mind that I was going to wake up and I was just going to be liposuctioned and looking great. But really there's all this trauma to the body, so it fills up with fluid. And so when I was able to actually look at everything and I wasn't so pain meted out, I was like, what did I do? I'm blowing up and things like that. And so it took, like you told me, patience, and then I had to learn that. And once I started seeing results.
Well, you know, I can tell you at 6 weeks, it looks really good. I mean, I mean, you definitely have swelling. There's no question about that. But your shape and form looks really good. It's nice and tight in your oblique region. I mean, this is very athletic in appearance. This is going to stay there. This is going to be persistent, actually.
Okay.
This is going to come down along here.
Yeah, that's what you're saying.
This is going to come down here. This is going to come down here too, in terms of the swelling in the back is the last to go.
Right.
And so as this goes, your butt looks nicer, actually. You turn around for me. Okay, good. So you've got nice fullness and nice plumpness. You know, your buttocks is less, you know, square and more round. It's more full. It's got a nicer takeoff here. And it will improve the shape as more of this swelling comes down here. So I think if everything looks good, it looks nice and full through the thighs here. You can turn around. Let me turn around like this here. Okay, good. And turn around towards me all the way. Now this is going to take time. All this is going to take time. Your scar, you know, is going to take time.
I have to say that the scar looks a lot better.
Yeah, it looks better out through here. As it gets in through here, it's going to look tighter. It's going to take longer. But that will, I mean, that's just a matter of time. This will improve as time goes on. The coloration, all this will come back. You know, your belly button looks good. It's
Love my belly button.
It's an innie. It's going to stay like that. So, I mean, at 6 weeks, you're doing great.
Let's talk a little bit about the numbness, because I wasn't really aware of, like, I know that it's numb, and like even the bum is numb, you know, for a period of time. You know what I mean? And so around my scar area.
That usually is the area from the belly button down to the incision is where the numbness is probably prolonged for up to a year.
Okay.
Everything else it kind of grows in.
There's like certain times that I like, because your skin dries and it's stretching and stuff like that, so I do put lotion on. But I'll like go to itch just out of nowhere, and I mean a shock will go. I'll feel shocks and stuff like that. So is that something that lasts?
Very common.
Yeah.
Nerves. Okay. Yeah. That's, I mean, you're going to go through a lot.
Yeah, I have to say that.
From this point on, now you're going to be becoming more active, doing more, working more, being more physical. You're going to go through a whole set of symptoms again. So, I mean, I would just keep doing what you're doing. I think your main thing now is getting back into your routine, get to work, burn those calories, and then things will really, you know, accentuate and take shape.
So all the healing we can see on the outside, and it looks good. What about my abs? Is everything good? Like, can I do ab workout or anything, or not yet?
You got to go really slow.
Okay.
I mean, really slow.
Yeah,
because once you start doing that, there's sutures there you can pull and stretch. You gotta gradually get into it. If it hurts, don't do it. It's too early to put a lot of stress on it, because the sutures really won't give. The kind that you have in won't give. But what happens is the tissue will tear.
Oh, see, I don't want that.
And you'll feel, you know, pain. I should see you in like 6 weeks.
Okay.
You know, come in, and any questions, call, send a picture, anything like that.
Awesome.
All right.
Okay.
Good seeing you. You're doing well. Hang in there.
Yes. Hi, I'm Wendy, and I came to see Dr. Delgado to have a Brazilian butt lift done, and I also had a tummy tuck. For as long as I've lived, I've never had a butt, and every girl wants a booty, so I decided that I would go in and look into doing not only a tummy tuck, but a Brazilian butt lift. After I had children, I had a lot of excess skin in my tummy area, And for years I looked into it because I didn't know if I could trust a doctor, because I didn't want some crazy ugly scar. I didn't know if I wanted to trade in one thing for the other. But I started doing more and more research, and I came across Dr. Delgado's website, and I read a lot of his comments on Yelp, and I really saw his work and I liked what I saw. So I wasn't as fearful to trade those two things out. So when I did go in to meet him, he was really nice. The office was wonderful. I felt very comfortable, and I had already seen quite a few doctors, and I just never had that feeling of this is the one. He was very professional, kind, caring, understanding. He explained things very well, and I liked that. Not to mention, when you're put under, you get a little nervous about things, and we're right next to a hospital. So what two better things than a great doctor and a hospital right next to you? So it was pretty much a done deal after I saw him in person and I felt the confirmation. And then next thing you know, I'm coming in to fill out paperwork and get everything done. So the day of surgery, I was really I'd say excited and anxiety ridden a little bit. You know, being put under is never like something you feel really great about. But everybody at the office made me feel very comfortable and very well taken care of. So once I got in here, the anxiety started to go away. Building up to the day of surgery, Dr. Delgado did let me know that it was going to be a rough recovery. I was doing two things at once, which was my butt, and then I was also doing a tummy tuck, which takes away both sides of me, which puts me laying on my sides for the next 6 weeks. And so I looked into it, and I did a lot of research online and watched stories of girls who had tummy tucks and they're in their first week of recovery, second week of recovery, and things like that. And so I thought I was prepared. Well, you're never really prepared. Basically, you just have to get through the first few days. I'd say a week. Once you get past the first week, you can feel more relaxed. It is painful, I'm not gonna lie, but it's well worth it. You know, you get through that pain and then you start seeing results in week 2 or week 3, whichever it is. Everybody's different. So I'm gonna tell you right now, don't go by that one girl on there that looks so amazing on week 2 and think that's going to be you, because it may not be. That wasn't me. It took me 3.5 weeks till I was standing up straight, or almost straight, when I had watched all these videos on YouTube, and one girl was standing up straight on week 2. And so I'm like, why aren't I looking like this? So then I'm getting anxiety. Again, did I do the right thing? Did I make the right decisions? And so I'd call the doctor. And that's another thing. Dr. Delgado, he gives you his cell phone number, his home phone number, whatever it is to make you comfortable to where you know you can come to him at any time. And I really appreciated that, because I'm a big baby when it comes to getting anything. I'm a horrible patient. And he was really good to me, and so was the staff. You know, they responded to me when I'd email. You know, whenever a doctor could get back to me, he would. And I just really, really appreciated that. After surgery and waking up, a lot of people are kind of scared to think about how they're going to feel when they wake up after. That's another thing I noticed a lot online, is people were scared of that. I didn't have no problem when I woke up. It was just you're groggy and you are in pain, but not a whole lot. A lot of stuff's going on. And so getting home, I just tried to get comfortable. I had care around the clock for quite a few days. I had really tight skin in my surgery, so my situation might be different than yours. You may only need a couple days or 1 day. I had people with me for over a week. I liked that, and they were really good caregivers. So just be prepared to go around the clock with your medication. Have somebody that's going to time that stuff and give it to you properly. That way you don't feel as much pain. That's, I would say, is one of the most important things. And then if you're going to be doing both of these procedures together, just have somebody that's going to help you get in a position to where you're not stretching out, or you just got to find what's good for you, basically. And I'd have to say the biggest thing is just listen to the doctor. Wear your bandeau suit like he tells you. You know, just because somebody else doesn't wear it, always wear it for the amount of time he tells you to. Don't sit on your butt, you know, for the amount of time he says. Do the things that you're told to do, and you should have a good, successful story. So I'm now at the 6th week of my recovery, and I'm finally standing up straight. I'm feeling good. Last week I got to start back to work, which was awesome. I'm a massage therapist, so for me personally, I use a lot of muscles in my own body. And in the procedure for the tummy tuck, you learn that you do use your abs for a lot of things in life, even the simplest things. So be very careful, be good to yourself. So it really felt good to get back into the swing of work and taking care of my kids and doing all the normal things that I do every single day. So I'm feeling pretty good. The scar's lightening up a lot. Be aware that after surgery, you're gonna be swollen. Don't feel like I should look like an hourglass figure after day 1 or week 2. Those things, they just have to come together. I'm not even down to my normal weight yet. And you know, you stay swollen for a little bit and you just gotta be okay with it and learn to love what you see in the mirror. For those of you who are looking into this surgery, it's worth it. It's really worth it. And then you just gotta be patient. That's a big thing.